Doctors and other staff at a GP practice in East Devon have been getting on their bikes to visit housebound patients or commute to work. Half a dozen e-bikes have been donated to the Honiton surgery as part of a Royal College of GP scheme to boost activity. It's also encouraging patients to get fitter and healthier. GP at Honiton Surgery, Dr. Daniel Murphy, caught up with producer Caroline Adams this week to find out how it all came about.
We recognised, particularly during the pandemic in the practice, that it was really, really difficult for patients and staff to be as active as they'd like. And we know that physical activity is so important for your health. So many benefits from your heart, your lungs, strengthening your muscles, your joints, for your mental health, reducing loneliness, reducing isolation. So what we wanted to do is we applied to what's called an active practice, the active practice charter. That's something the Royal College of GPs do to recognise practices who are really promoting physical activity and health, both for their patients and local communities and their staff. And we know that 1 in 4 people would be more active if their GP or practice nurse recommended it. So we wanted to become much more proactive. And one of the things we did as part of our application was been really lucky in that we've been donated some electric bikes by both Raleigh and Volt, which is amazing. We've used them in loads of different ways. So we've had them for 2 months, and in that 2 months we've done over 400 miles on them. GPs are now doing their home visits on bikes, which is brilliant because it helps reduce GP stress. We realise that we're all under huge pressure. Actually getting out and being active really helps that. Staff are using them to commute to and from work, which is amazing. And the other thing that we're really proud of is we've got an in-house mental health team, because we recognise that during the pandemic, people's mental health has been a real issue. And they're now using electric bikes and walking to really help people with their mental health, to help support them and improve their mood, reduce their isolation. So we've been using it for that as well.
So, in fact, the patients have been actually using any of these bikes?
Yeah, so patients have been using them and staff has been using them as well. So we've got, actually in the practice, we've got some a mental health team and mental health practitioners who work with people who are struggling with their mood in particular. And one of the things they're really proactive and brilliant at is helping people's activity and helping them get out and meet people and enjoy the outdoors. So taking them out on walks and also taking them out on the electric bikes, using them as a way to try and promote physical activity to improve your mental health.
And you were saying for staff, people like you, it's very tight. We know GPs are under stress. It must be lovely to actually just walk away from the practice, jump on the bike and just have that little breather, literally, as you go between patients.
Absolutely. So we know that exercise is a really effective treatment for stress and anxiety. And, speaking as a GP, I can say that I'm really stressed and spend most of my days feeling quite anxious. And so just being able to step away, instead of eating my lunch in the car on the way to visit a frail, elderly housebound patient, we can use the bike to say, actually, let's just decompress for a minute. You can cycle there, you can see the sky, you can hear the bird song, you can exercise and get your heart rate up, and it helps reduce all those stress hormones. It's actually quicker in lots of ways because you're cycling through the town, you don't need to park, you don't need to worry about where your car's going to be, and you just get back in a better frame of mind to then restart your afternoon and start helping more people.
And it must open a bit of a conversation between you and patients, really, and a bit of an icebreaker too when you pitch up.
Yeah, I think that's one of the things that we've been really, really hopeful that this does. This, as you say, start a conversation and be, very visible, being more active. And hopefully people see us cycling through the town and say, oh, blimey, look, there's a GP on a bike. It's not something you see very often. It sort of goes back to the 1950s, doesn't it? But then starts a conversation for them, hopefully, to say, well, what might I be able to do? If I'm seeing Dr. Murphy out and about cycling on a visit, is that something maybe I could do as part of my day?